The electrocardiogram, or ECG, it's not just some machine with beeps and squiggly lines. It's actually a storyteller, and with every single beat of the heart, it's writing out a story. In this explainer, we're going to break down exactly how you perform one, step by step, so that you can capture that story perfectly.
So at its core, an ECG is really just a recording of the heart's electrical signals. But wow, what a powerful story it tells. This quick, totally painless test gives you an incredible snapshot of the heart's rhythm and its health. It's like having a direct window into one of our most vital organs.
And that, right there, that's the million-dollar question. Getting a clear, accurate ECG isn't just about flipping a switch or pushing a button. No, it's a craft. It's this unique blend of human connection, really careful preparation, and some technical precision. So how do we get it right?
Well, you might be surprised to hear that the very first step has absolutely nothing to do with the machine. Before you even think about connecting a single wire, the foundation for a great ECG is built on trust and just clear, simple communication with the patient.
These first 4 steps, they are all about the patient. When you introduce yourself, confirm who they are, explain what's about to happen, and make sure they feel private and respected, you're doing so much more than just ticking boxes on a form. You are building the rapport and trust that you absolutely need for a successful test.
All right, so with that trust established, now we can get to work setting the stage. This next part is all about the prep work, the stuff that guarantees the final recording is as clean and accurate as humanly possible.
Think of this as your pre-flight checklist, right? We make sure our hands are clean, the patient is positioned just right, lying flat on their back, and that they're comfortable. And of course, we give the machine and all its cables a quick once-over. Every single one of these steps helps minimize potential problems down the line.
Now, this might seem like a super simple thing, but trust me, it is critically important. The little electrodes need to have perfect contact with the skin to pick up the heart's tiny electrical signals. Any barrier at all, we're talking oils, lotions, even hair, can create interference. That's why making sure the skin is clean and dry is, well, it's absolutely non-negotiable.
It really is like tuning an instrument. Think about it. You wouldn't expect a beautiful sound from an out-of-tune guitar, would you? It's the exact same logic here. All this prep work is how we tune our setup so we can capture a perfectly clear signal from the heart.
Okay, the stage is set, the instrument is tuned. Now we get to the technical core of this whole thing. This is where precision becomes everything. We are essentially creating a detailed map to view the heart's electrical activity from a bunch of different angles.
And to build this map, we use 2 totally different sets of leads. Each set has a very distinct but equally important job to do.
First up, you've got the limb leads. Think of these as giving us the general, wide-angle view of the heart's electrical flow. Then the chest leads come in and they zoom right in, providing 6 different close-up snapshots from the front and the side. You put them together and you get a comprehensive, almost 3D picture of what the heart is up to.
The limb leads are pretty straightforward, thankfully. 1 on each arm and 1 on each leg. You usually put them on the fleshy parts of the wrists and ankles. It's simple, but these form the foundational frame for our entire electrical map.
All right, now for the chest leads. This is where precision is everything. The best way to think about it is as a sequence. First, you find the 4th intercostal space. That's the little space between your 4th and 5th ribs. V1 and V2 go right there, on either side of the breastbone. Easy. Next, we actually skip V3 and find our landmark for V4, which is in the 5th intercostal space. Once you've got V4 locked in, V3 is a piece of cake. It just goes right in the middle of V2 and V4. And finally, V5 and V6 just wrap around the side, staying on that exact same horizontal line as V4. Nailing this sequence is what gives us those incredibly important detailed views.
Okay, all the leads are placed. All the prep work is done. This is it. This is the moment of truth we've been working towards, capturing the actual ECG tracing.
This phrase right here is the single most important instruction you can give the patient. The machine is so incredibly sensitive that any muscle movement, even from just talking, can create noise that completely messes up the signal we're trying so hard to capture. And the big reason we need the patient to be still is to avoid this guy, artifact. The best way to think of it is like static on a radio. It's any electrical interference that pollutes the signal, making the heart's true story difficult or sometimes even impossible to read. And you can see the difference clear as day. Over on one side, a beautiful, clean tracing. The baseline is flat, then every part of the heartbeat is sharp and clear. Then you look at the other side. A tracing that's just full of artifact. It's fuzzy, it's messy, and you can't interpret it with any confidence. All of our prep work, everything we've done up to this point, is to get that clean result.
So the recording is done. We got the shot. But our job is not over. Not yet. A professional procedure requires a professional finish. It's about making sure the patient is cared for and that everything is wrapped up and documented correctly. So, we just run through our final checklist. We save the tracing, we gently remove the electrodes, and we make sure the patient is comfortable again. Then, we clean up the equipment, wash our hands, and, this is critical, we document that the procedure was completed. It's all about closing the loop with the exact same care we started with.
And that's how it's done. It's this perfect mix of human connection and technical precision, all just to capture the simple yet incredibly profound story of a heartbeat. It really makes you wonder, doesn't it? If this much information is hiding in a simple electrical tracing, what other amazing stories are just waiting to be told by the simplest tools we have, if only we learn how to listen in the right way?